Well, welcome back, everybody, to the Now Morning Show here on TTT. We are also live on Talk City 91.1 FM and on Facebook at TTT Live Online. So today, as we mentioned earlier, is World Kidney Day. The aim is to raise awareness of the importance of your kidneys to our health and to reduce the frequency of the impact of kidney disease and its associated health problems. With us this morning, Dr. Edmund Michael, who is a family practitioner. And we're going to talk a little bit about some of the work that you are doing, your school, and also how people can manage their health, especially kidney, as we commemorate World Kidney Day. Good morning, Doctor.
Good morning. I'm happy to be here.
It is a pleasure having you here because there is the Institute of Medical Education in San Fernando. That's number 60 Gordon Street in San Fernando. And you train people there.
That is correct. We train the vast majority of people who wish to learn how to dialyze patients, hemodialysis, which is really dealing with dialyzing using the blood and to be able to clean the toxins out of their system.
Can you explain to us what hemodialysis is?
Okay, basically I should start by saying that we have over 1,000 people in this country dialyzing at this point in time for renal failure.
Mm-hmm.
When your kidneys fail, obviously the toxins which are built up, which you normally excrete when in normal urination,
mm-hmm.
you're suddenly in a situation where you cannot do that. And you also have, if you can't urinate, obviously you'll build up a lot of fluid in your system. So dialysis, therefore, is responsible for helping to purify the blood out of those toxins, and also it also helps to take away a lot of the excess fluid
mm-hmm.
and water that builds up in your system. It is an extremely important modality because without it, people who have renal failure will surely die.
So when it comes to the training, what exactly is done? What are people taught?
Okay, we train both registered nurses and non-registered mm-hmm. nurses. In North America, in most metropolitan countries now, prior to this, we used to only use RNs, registered nurses, mm-hmm. to dialyze. But this has changed simply because you have, of course, limitations of your number of registered nurses. And we have a lot of people we bring in who are not nurses and who we train to how to dialyze. And we have found this to be very effective. And we supply dialysis personnel to most private institutions and some public institutions in this country. Our school is approved by the Accreditation Council of Trinidad and Tobago on the GATE funding, so the GATE pays for their training. And we train people, and we also train some people from outside of the country. For example, we had a nurse who came from Anguilla, mm-hmm. Which is, of course, a very small country, and she was given a scholarship to come to our school. She had the choice to go to the United States, but they chose to come here, and for she was very happy to be able to train her in all the niceties of hemodialysis.
And people are coming on board in this institution to be trained in this area?
Absolutely. Yes, we have trained several hundred people. If you go to any private dialysis center, you'll find that the majority of people who are doing the dialysis have graduates of our school.
And there's also the IME Dialysis Center, which is at 16 Donaldson Street in San Fernando.
That's correct. Now, we must understand that if we are training people, we have to operate at a very high standard. Mm-hmm. And to be able to operate at such a high standard, we created the IME Dialysis Center, which will act as a training ground for the students under strict supervision and under the strictest rules of excellence. So we not only train people in our school, in our center, but also several of our students go to other centers over the length and breadth of the country. Right now, this center really is responsible for dialyzing people from San Fernando and catchment area all the way down to Cedros. And it's very hard for these patients to be coming 3 times a week, 3 o'clock, 4 o'clock in the morning to be able to dialyze. But unfortunately, that's the problem with kidney disease. May I add one thing?
Yeah.
I'm an American trained specialist, and I practice in the United States. I went to medical school and did my specialty training in America. And when I practice in America, the average patient will come once a year and get a routine physical. That is not so in Trinidad. The average Trinidadian thinks that nothing wrong with me, I feel good, why going to doctor for? And unfortunately, quite often, these patients have high blood pressure, some of which you know, some of them have diabetes, which you have not diagnosed, and basically end up with renal failure or serious kidney disease. And by the time it's diagnosed, of course, it's very advanced.
So how often should someone get their routine physical?
Once a year, you should take a very rigid physical. when I do rigid physical, I pick up early cancers. I pick up certainly kidney disease. I've trained at the University of Western. I've trained medical students at Mount Hope, and I've also trained general practitioners. I'm the specialist general practitioner, if you want to put it that way. So I've trained general practitioners at medical school at Winning to be able to let them improve their skill.
Yeah. So as we commemorate World Kidney Day, what sort of advice would you give to members of the public?
The advice I would give to members of the public is to take a check. If you have high blood pressure, don't ignore it. Some people have high blood pressure and they say, well, I took my tablets and my pressure went down and I feel that I'm cured. I stopped the medication, not knowing that the damage being done to their kidneys is ongoing. And of course, the people who are diabetic and who supposed to follow certain diets and eating everything under the sun, drinking sweet drink, drinking everything and doing everything that they shouldn't do until they end up with problems with their kidney.
But people hear these things all the time and people give advice all the time on these things, yet people don't tend to take the advice. How do we deal with that? How do we get people to follow a pattern of healthy lifestyles?
I think part of the problem, though, I have to blame some of my fellow practitioners. I think that doctors have to reinforce to the patients the importance of having certainly that yearly check, and certainly those who have high blood pressure and diabetes should be checked, to my mind, at least once every 3 months to check the status. Because I will tell you something, I have several patients we have 5 stages of kidney disease, chronic kidney disease, and stage 4 is when I realize the patient, I have to get that patient ready to dialyze. And if I see the patient at stage 1, 2, or 3, I can start taking in front before in front take you, as it were. And but how are you going to know it unless you have a check?
So are there any signs that people can look for at home to know if they have sort of kidney problems?
Well, certainly high blood pressure is a silent killer, as I tell you. And often the sad thing is that often they have having this damage to the kidney without they realizing it. And that is really the sad part. So I often pick up patients on routine checks and check and see that their creatinine, which is a breakdown of the muscle, and their urea is a breakdown of protein, and that's elevated. And obviously, these patients are having problems.
Yeah. And I know Carrie is here with us as well. Carrie, do you take your yearly physical? Do you? Have you ever done it?
Honestly, no, I do not take it as often as I should. To do a full medical test at least once a year. Honestly, I don't, and that's something I need to pull up on.
How do we get people like that to do their physical?
It's worth it. I can tell you, I've done over 2,000 autopsies in the past at San Fernando General Hospital.
2,000 autopsies?
And I can tell you half of those people, autopsies I done, as far as I'm concerned, had premature deaths because Trinidadians just don't believe in preventive medicals. And it's very unfortunate. And then they end up in the autopsy room. And it's very unfortunate.
So it's better to go, of course, better to go see doctor's office than to end up in the autopsy room, right?
What often my patients in the United States used to do is that they would, on their birthday, they will use that as a marker to get their physical.
I saw somebody on Facebook saying, drink plenty water with lemon juice.
I don't know about the lemon juice part. I mean, certainly you drink enough fluids, certainly. Not if you have kidney failure, because you certainly, in kidney failure, since you can't pass on urine through normal urination, obviously you have to restrict the urine, you restrict your fluids very drastically. It's very often sad.
Doctor, is there any information that you want to give as related to contact information for people probably wanting to come down to the institution?
Absolutely. The school's number is 657-7718. The dialysis center number is 222-1778. And I'll give my cell phone number, 464-8354. Maybe I think there's two last things I'd like to add very quickly. Because we have the responsibility of training people, we are going to have a very major symposium on June the 9th of this year at SAPA. And the reason for that, we're bringing in people to give the most modern advances in hemodialysis. And we're bringing experts from the United States and to be able to do this program. And one last thing I'd like to also add is that we understand a lot of patients who are dialyzing have things like cramps, and we have added a spa, basically, where we do corrective medical massages for these patients who have these problems like cramps, etc., which is located in the same building at the 16 Dawson Street, and that spa does enormous spa things, but it's something we do.
All right, well, thank you very much, Dr. Edmund Michael, family practitioner, for coming on and chatting with us this morning. Some very, very good information.